So in this mega MADIT study, we actually combined our previous MADIT family of trials. We combined MADIT-2, MADIT-CRT, and MADIT-RIT, and we have a total of 4,000 patients in this study. So in the mega MADIT study, we analyzed the rate of ventricular arrhythmia events as well as the rate of deaths, and we specifically looked at co-specific deaths. And death events in the MADIT studies were uniformly adjudicated, and the rate of ventricular arrhythmia events were collected from the ICD devices. What we found in mega MADIT, that in the MADIT-2, MADIT-CRT, and MADIT-RIT studies, there was actually a decline in the rate of ventricular arrhythmia events and also a decline in deaths over time. And what was really interesting is that when we looked at specifically at ICD patients only who had ischemic cardiomyopathy, then these patients seemed to have a similar rate of ventricular arrhythmia events in the very first study, MADIT-2, as well as in the last study, MADIT-RIT, even though the patients were enrolled over 20 years apart. But when we looked at the CRT subpopulation, CRT patients actually had a lower rate of ventricular arrhythmia events in the MADIT-CRT and MADIT-RIT trials, suggesting that potentially cardiac resynchronization therapy was at least in part responsible for this reduction in events. But the study has several important clinical implications. Most importantly, the rate of ventricular arrhythmia events seems to be stable in ICD patients. We also have indications that the rate of ventricular arrhythmia events as well as deaths is significantly lower in patients with cardiac resynchronization therapy. That is a very potent treatment option for patients with a wide QRS and heart failure. Nevertheless, we think that we need future studies to allow for more appropriate risk stratification of this patient population that takes into consideration the use of CRT as well.